Well, hi, everybody.
Hello,
Welcome.
Heather.
Hello, hello. Welcome to this is the State Street Forum, the February 17th, 2022 edition. And the State Street Forum is a conversation about issues related to faith and public life, drawing a connection between uh, things that are of concern in our public life and our faith. And our goal in this gathering is to empower people of faith to speak into the public sphere, to speak into issues of public concern with greater confidence and to be effective in raising their voice and affecting change. The State Street Forum is a co-sponsored event, co-sponsored by the Westminster Presbyterian Church in Albany, where I am the pastor, and the New York State Council of Churches, where Reverend Peter Cook is the executive director. And Peter is here with us right now. And also co-sponsored by the Focus Churches of Albany, where Fred Bohr is the executive director. Fred has just gotten back from a 5-day spiritual retreat and was not sure he would be able to join us today. But we thank the Focus Churches for helping with this forum. Our speaker today is Dr. Terry Diggory. And I'll introduce Terry in just a moment. Peter, did you want to say anything on an introductory level about our conversation today?
Well, we're really looking forward to having Dr. Diggory speak. So welcome. We, uh, are very aware of the fact that while the pandemic appears to be waning, or it's certainly not as intense as it was, that there are so many people who are left behind due to low wages or unemployment, or that we have not adequately invested in fair wages and our social safety net, especially in the area of healthcare and also childcare and housing. So today we're going to take a deeper look at this dynamic and explore some steps that we can try to make better.
And I need to just say by word of explanation, and maybe this helps with our introductions as well, that the Westminster Presbyterian Church is currently one of the two pilot programs in USCRI, a refugee resettlement agency here in Albany, New York. They have a Good Neighbor program that partners communities, either faith communities or just other groups, with families of Afghans who have recently been evacuated from Afghanistan and are resettled here in Albany. And our church is in partnership with a family. And just about 20 minutes before our gathering now, that family called some members of our team because the mom in the family is sick and they have no health coverage. But right now, I can see I'm getting a call from the team member who went over to help that family. And so after I say a word of introduction, I'm going to just mute for a second and attend to that, and I'll be right back in. But quick word of introduction to Terry. Terry is a man who has worn many hats, a leader in many ways. He's a retired professor of English at Skidmore. And he is also an elder at the Presbyterian New England Congregational Church of Saratoga Springs, which is a joint denominational church of the PCUSA, the Presbyterian Church, and the United Church of Christ. Terry is a former moderator of the Albany Presbytery, and he's currently the co-coordinator of the Albany Presbytery's Immigration Network. And he also serves as co-coordinator of the Saratoga Immigration Coalition. Now, both of those coalitions provide material support, but also advocacy, education, and other actions to help meet the needs of immigrants in the communities where they work and live. And Terry has been very involved with a couple of advocacy efforts in that pertain to this current legislative season, and one pertaining to healthcare and another to wages. And I want to hand it over to you, Terry, to tell us more about that work.
Thank you, Heather and Peter, for this opportunity. Also, thank you, Heather, to your congregation at Westminster Presbyterian for the help that you're bringing to the Afghan family that you mentioned. I hope that you get good news from your phone call. As I understand it, we're to talk today about two issues relating to the welfare of our community overall, but specifically with regard to the community of members of the community who are immigrants, that is equitable and effective healthcare and equitable wages. So I'm going to touch on some legislative initiatives that are currently pending in the New York State Legislature that we can all do something about in terms of advocacy. I'll start with just sharing my screen here. Just to give a real, with regard to healthcare, just to give a real 8 miles up overview of the issue of inequitable disposition of healthcare. These are some, I think, pretty stark statistics indicating, as you see, that at the for citizenship status, for those who are not citizens in this country, 21% do not have health care coverage. And then if you look over in the right-hand column there for ethnic or racial breakdown, 10% of those who are Hispanic or Latino do not have healthcare. So there's quite a disparity in terms of immigration status and also in terms of ethnic status. So right now, being brought to the state legislature is a package of proposals that I'm actually very glad to see come together as a package, because for the past several years, there have been separate campaigns backing these various initiatives. And of course, there was some attempt at coordination, but now there's a real effort to bring these campaigns together to coordinate for an effective, comprehensive program that would address these kinds of disparities in healthcare coverage that this chart is showing. The gold standard, in a sense, would be passage of the New York Health Act, which is a single payer plan for New York State. I think everybody who is behind this effort for single payer coverage would prefer to see federal coverage that would be single payer, but because that seems to be a very long time in coming, I think there is a good chance that New York State will get its legislative head around a New York Health Act. And as you see on this slide, there would be tremendous cost savings if there were to be a single payer plan. This would be truly a comprehensive plan. It would cover immigrants regardless of their immigration status. It would cover everyone in New York State, including the Afghan family that Heather just mentioned. And it would be comprehensive in its coverage of medical needs, vision care, dental care as well, without co-pays or deductibles. It would be funded through a progressive income tax. Some people would end up paying more in their income tax to make this affordable, but everybody ultimately would be paying less in terms of what they pay for health insurance. Specifically with regard to coverage for immigrants is the campaign known as Coverage for All. And the way in which this coordinates with the New York Health Act is the New York Health Act, being such a comprehensive plan, would take probably actually a number of years to implement once it was passed. Whereas Coverage for All is something that could be implemented right away. It's a very simple idea. It would simply mean extending the current Empire plan. That's what's referred to on the slide as EP. The Empire plan provides Medicaid coverage depending on a calculus relating to the federal poverty level. And currently it's funded through federal funds through the state. But the idea of Coverage for All is it would assign state money to extend coverage under this plan for undocumented immigrants. And you see here the cost estimates. 46,000 people could be covered through 345 million appropriation annually, and it's estimated that 154,000 people potentially could benefit from this plan. That is currently 154,000 residents in New York State do not qualify for healthcare coverage because of immigration status. The third tier in this package would be a attempt to address the issue of medical debt. And there are three different pieces of legislation that would address this. Each of these slides, by the way, has been showing the Senate and Assembly bill numbers so that when you address your state legislator, you can address the particular legislative bill that you are advocating for. So the first of these end medical debt provisions would simply ensure that hospitals provide information about coverage that's available and increase coverage, increase assistance up to 600% of the federal poverty level rather than the current 300%. The middle bill that's shown on this slide would ban liens and wage garnishments in relation to medical debt. And then the third provision on the right-hand side of this slide would banish facilities fees that sometimes show up surprisingly on bills relating to outpatient coverage. And it would require that if the hospital is charging such fees, that they make that clear to the patient before the patient seeks coverage at that hospital. So this three-part package, the New York Health Act for single payer, Coverage for All, for a Medicare plan for immigrants who would not otherwise qualify given their immigration status, and then ending or at least attacking medical debt through these three provisions would be part of a comprehensive plan for addressing healthcare inequity, and specifically, certainly including immigrants in that concern. Then finally, for wages, there are, again, two issues in particular that are coming to the legislature, or one actually is coming through the Department of Labor to the Labor Commissioner. And this is the 40-hour overtime threshold for farm workers. In 2019, there was a bill passed by the legislature, the Farm Laborers Fair Labor Practices Act, and that provided for an overtime threshold for farm laborers of 60 hours, beyond which overtime would kick in. The Fair Labor Wage Board has recently proposed bringing that threshold into line with other labor laws, so a 40-hour threshold after which overtime pay would kick in. And that's being recommended to the Labor Commissioner, and she has the authority to decide on how to respond to the Wage Board's recommendation. So advocating with her that she accept that recommendation would be an important step. The Excluded Workers Fund is something that was established very successfully in the current budget year. Last year's legislative round, $2.1 billion was set aside to offer unemployment compensation to workers who would otherwise not qualify for such compensation, mostly because of their immigration status. That 2.1 billion was very quickly exhausted. So there is a request to replenish the fund in the current budget year with another $3 billion, and to establish a permanent fund ongoing with an initial appropriation of 800 million that would ensure that such measures don't have to continue to be established by emergency acts, but rather that it would be recognized that the COVID-19 emergency is not the last emergency that we're going to be facing, and there's a need for an ongoing fund to provide for that need. The Excluded Workers Fund does currently have a petition, and I've put the link for that petition here, and I'll be providing a document that includes a number of links that people can use for getting further information about all of these issues. I just want to say very briefly, and I'll stop sharing at this point, but very briefly about the theological and ethical framework, at least that I feel I want to act in for these causes. With regard to immigration advocacy in general, there is, of course, the question, who is my neighbor? Jesus answered that with the parable of the Good Samaritan. And to me, our neighbors are like the Samaritan discovering the person in need along the roadside. Our neighbors are those who are present to us, and we don't ask questions. Jesus did not ask questions about, show us your identity card, show us your citizenship status, but you are present to us. What is your need? How can we help to address that need? Jesus was obviously also a healer, And Jesus was also incarnate, God incarnate. And incarnation is an important part of Christian theology, certainly. And it gives, I think, a special meaning to the embodiedness of human existence that we seek to address in healthcare. There are certainly, obviously, also the questions of ethical concerns that don't need to be founded on theological argument, that can also be founded simply on secular argument. That is the public health need. Certainly COVID-19 has demonstrated very dramatically that health is not a matter of individuals, health is a matter of communities. And we need to, I think, address public health in a responsible way so that to make sure that the entire community is included in public health considerations. And then, of course, there are simply the issue of economics, appropriate stewardship of our collective resources. And currently, the healthcare system has tremendous waste involved, tremendous administrative cost, and even the cost that increases for safety net hospitals because so many people have to, their only access to healthcare is to come to an emergency room. And the fact that additional cost is borne by the safety net hospitals is unfair to them, and also unnecessary, because preventive care, which could be provided through the New York Health Act, for instance, or the coverage for all provisions, preventive care actually decreases healthcare costs. So I think there are theological reasons and secular reasons, we might call them, for addressing the concerns that we've been talking about. So let me stop there. I'm happy to engage in conversation at this point, and I'll also drop into the chat a document that has actions that are coming up and links that people might want to use for following up on these issues.
Terry, thank you so much. I actually do have a couple questions for you, and I'm guessing other people on the Zoom do too. But I was wondering if you would be willing to answer one brief biographical question before we talk about the issues. And I have wondered before, and now have my opportunity to ask you, how did you, as a professor of English from Skidmore, become such a passionate advocate and such an effective advocate for immigrants in your community? What began this particular ministry for you?
Well, I have to say it came about through my church affiliation rather than through my literary affiliation. Although I like to think that literature is an important tool for empathy. When you're reading, you're constantly being invited to step into other people's lives and feel what it's like to live those lives across times, that is for all ages, and of course across cultures as well. But I've also, at the same time that I was being an English professor, I was also a participant in my local congregation that you mentioned in Saratoga Springs. And that congregation has always been very active in community efforts, and through my engagement in that, and then more broadly through Albany Presbytery, I saw both learned about needs in the community, but also learned about the effectiveness of advocacy through faith communities. And that was very encouraging. So it's been, going from one cause to another. Saratoga Springs, of course, locally has issues relating to immigrants because of the Saratoga racetrack with migrant workers, because of farm workers in our surrounding area. So it's very easy when you live in Saratoga Springs to become aware of, on a very local level, of the fact that immigrants contribute a great deal to our communities and also have very special needs.
So then, I'm not going to dominate the conversation, I promise, but then let me ask my other, I have been curious about question. I understand, I mean, there's the undocumented community in the US, there's a lot of different people who meet different profiles. But as you said, in your area, there's specific industries that employ more than a few folks who are undocumented. One's the racetrack, and one is the dairy farms up in upstate New York. How is it that those folks receive any health care whatsoever? Is there a sense that the employer sort of looks after people, or is it just the sense that everybody's on their own? I would just think when you have a workforce that an industry is depending on, where people could be injured on the job as part of the job, that the employer would have like a very huge financial incentive to find some way for these people to have health coverage, courtesy, like a public coverage for their workers. I would think they would be at the front of lobbying for this, but obviously they're not.
Well, employers do play a role, but it's a limited role and occasionally a reluctant role. Let me just add to the list of industries that we talked about so far, from the local perspective of Saratoga Springs, another area that relies heavily on immigrant workers is the hospitality industry, restaurants and hotels as well. To give you one example of healthcare being provided and the tenuousness of the healthcare that's provided at the racetrack, there's an organization called BEST, which is the Backstretch Employees Service Team. So the backstretch employees are the workers who work at the racetrack as grooms for the horses, hot walkers for the horses. They're basically the essential infrastructure behind the scene that maintains the racing industry. And through the organization called BEST, a healthcare clinic is provided on the backstretch at the racetrack. But a couple of years ago, maybe 3 or 4 years ago, funding for that clinic was in jeopardy because the Thoroughbred Owners Association and NYRA, the New York Racing Association, were looking at their budgets and trying to cut back on the funding that they supplied to maintain the clinic. So it got to the point where BEST was feeling that they would no longer be able to run the clinic for the racing season in Saratoga. The Saratoga Immigration Coalition felt that obviously this was a concern with regard to our mission to support immigrants, but also, again, a public health concern. That is that we were bringing in over 1,000 workers to New York, to Saratoga over the summer, who might not be receiving adequate health coverage. So we launched a petition. We addressed the New York Racing Commission at the state level, the office of the governor, and basically attempted to publicize and bring public concern about the possible withdrawal of funding for this clinic. And as a result, NYRA, the New York Racing Association, and the Thoroughbred Owners Association backed off, and they recommitted funding to the clinic. But again, that's just an example of both what is being done and also how precarious that kind of provision is. And that's why I think we really need to address this at the state level and to make sure that everybody in the state has adequate healthcare funding.
That is like a fabulous example about how the sort of direct service approach is not going to fill this need, that we really need to work on advocacy for a more comprehensive solution.
Absolutely.
Yeah, so let me open it up and see if others here on the Zoom have a question for Terry. for Terry. Yeah, go ahead, Margaret. Oh, yeah, unmute if you would.
Okay, you got it? Can you hear me?
Yep.
All right.
Gotcha.
I read in the paper a while back, this has to do with the fair wage, the 40-hour threshold for farm workers, that farmers say that they can't, that they would just have to go out of business if they had to pay more than, had to pay that. What can you give me your take on that?
Peter, you want to address that?
Well, I'm curious to hear what you say, and then I'll fill in.
Okay. There are a number of attempts to address that concern among farmers. Of course, one of the things that farmers say is that for many of their products, prices are regulated in various ways. Milk prices, for instance, are regulated. And one obvious way to address that is, if costs go up for farmers, then you address the regulations. It is also the case that the governor has made a proposal for a additional tax credit for farmers that would apply to what they might be paying for overtime wages. So they would get a tax offset as overtime wages were to increase. The other thing that's often not mentioned about this, the proposal from the wage board, is that it's a very gradual implementation. It doesn't kick in until 2024. So already the farmers have time to plan for how they would adjust to the requirement. And then starting in 2024, it's phased in over a 10-year period.
Oh.
So this is not something being suddenly imposed, but farms would have a chance to adjust. So I don't know, Peter, you want to add from your perspective?
Absolutely. I mean, this is not a radical proposal. I mean, it's running over a 10-year period, and the tax credit proposed by the governor corresponds to that rise. The credit gradually, excuse me, increases as the number of hours eligible for overtime increases, but it's a very gradual kind of process. I do think that other supports that also eat into the bottom line, like healthcare and so on, would also be of support, in terms of farm profits. as well. So, you know, the advantage of having something like a single payer health system that is disconnected from the employer also is a tremendous help in terms of profitability for businesses if that cost can be taken off their heads. And particularly if they're having to bear a cost because of their employees, because they have no access to health insurance.
Absolutely. Peter, I want to thank you for correcting me. I saw in the chat you mentioned it's not the Empire plan, it's the Essential Plan that's being extended for the excluded workers. I get hung up. There are too many acronyms.
No,
in this
it's
business.
it's insane. Yeah. So, yeah, but I think there's a good shot of getting this thing passed this year, the Essential Plan. It is not really a lot of money in the grand scheme of things. And while New York Health Act would really be, as Terry said, the gold standard here, getting coverage for all passed and the medical debt provisions passed would be a very helpful step in the right direction. There are also some provisions that are laid out in our legislative ask around Medicaid as well, of lifting the Medicaid coverage or cap, or at least modifying it to make Medicaid more of an entitlement, and Medicaid is very comprehensive in what it covers. The problem is that for immigrants, they can't access that Medicaid plan with federal dollars. It really takes state dollars to be able to make that happen.
Well, I'm very intrigued that with the healthcare coverage for those people who don't have immigration status. I'm intrigued that you think that has a chance in our legislature. I feel like our team and our congregation, for that matter, should really speak into that effort very directly. I mean, even as we speak, we are currently taking somebody without, healthcare coverage to the emergency room at Albany Medical, which is her essentially best option within we now have 413 adults evacuated from Afghanistan, resettled in Albany with no other healthcare provisions. And that's also, I don't know however many children, probably at least that number children also evacuated with no healthcare coverage here in Albany. And no provision for Albany Medical, which is already extremely strapped due to the pandemic, to all of a sudden accommodate the full comprehensive health needs of people who, recently evacuated out of a war zone. And it just blows my mind that there's no other provision for healthcare as these folks arrive. No other plan than, take them to the emergency room. Which as we all know, is one of the most expensive possible ways to get treated for, injuries or minor ailments or whatever. Seems mind-blowing to me.
It's outrageous. And let me just say, building on that we have had a long history in this country of nice churches like Westminster Presbyterian all over the country who picked up and tried to address these needs of people who are struggling through charity. And while we are always grateful for those efforts, a lot of congregations really got to the point during the Great Depression of saying, we need the government to act. There's a limit to what charity can do. And the role of the church is to really call on government to act on these structural economic issues, which churches alone are ill-equipped to deal with. Government needs to do their job and not just pawn it off to faith communities.
Yeah, I would just add to that, Peter, that I know I have been involved in many conversations raising some questions about the extent to which the kind of charitable activity that a faith community might be willing to provide actually perpetuates an unfair system. In other words, we're able to provide some quick Band-Aids, and then the people, as you say, like the state, who should be responsible for the collective well-being, they say, oh, well, that Band-Aid was applied, that's being taken care of, so we don't have to worry about it. So it's a real dilemma. I mean, obviously you want to address the immediate need. You don't want to wait and say, you don't want to tell people coming to your door, wait for this legislation to pass. But at the same time, you realize that unless you are also putting pressure for the collective action of the legislature, that to some extent you are perpetuating the system if you're only doing the charitable effort.
Yeah, we see a very similar dynamic when we get to things like food pantries and also providing, shelter, homeless shelter. Sometimes you even have volunteers who are so invested in their ego and volunteering that they just either resist or don't think to advocate for the more structural kinds of changes that might put a homeless shelter and a food pantry out of business.
It's a fair point, but I actually think healthcare is the one that's sort of the first point of advocacy, because we can bring food over to our Afghan family. We could even help pay the rent of our Afghan family, but there is no way we could cover the medical costs.
Right.
It would put us into medical debt to, be paying. None of us could pay for our out of cash money, pay for our health care at the rates that, are charged at a hospital emergency room. Nobody could cover that. So, it's not realistic to say it's the only way a church can provide for this by charitable means, and churches do this, is find someone in their congregation or someone related to their congregation, a doctor, and this often happens with a dentist, who will donate services to somebody as a very special favor to the congregation. But even that it's rare, and Westminster right now does not have access to such a person who's going to treat our family just, out of the goodness of their heart. Hey, I will say Peter and Terry and I could go on like this at some length, but let me bring it back to others on the Zoom. If anybody else has a comment or a question to throw into the mix right now.
Gave me mine.
Thank you. Thank you for yours, Margaret. And
Okay.
if no one else has a question, we can keep going because I have several more. Yeah. Okay, well, let's take a minute to talk about the wage issue, Terry, because this is one that I have been a little confused about, just as Margaret said. The this is legislation has been passed already. It's a done deed about overtime pay. But then there was some exception made for farm workers that said overtime kicks in at 60 hours a week and not at 40.
Correct.
Are there any other exclusions besides farm workers to the 40-hour work week?
I'm not aware under this most recent legislation. I do know that when the federal legislation, and the whole idea of a set work week came about during the New Deal
Yeah,
under FDR, and that's when the initial Fair Labor Standards Act was passed at the federal level. But the two groups that were carved out of the provisions of that act were farm workers and domestic workers.
ah,
And of course, this kind of takes us back to the Excluded Workers Fund as well, because there's a whole category of workers that are, in a sense, even more under the radar in terms of official categories than farm workers are. Domestic workers, day laborers, people who are not on any kind of contract, but they're just working for wages as they're able to find work. And that's another category that the Fund for Excluded Workers was able to address. But going back to the original Fair Labor Standards Act in I think it was 1938 that was passed. The origins of that or the carve out makes it quite clear that there was a racist underpinning to the carve out because the carve out came at the insistence of Southern Democrats. They would not agree to pass the bill unless those exclusions were made. So as in so many other things that we're facing in our contemporary society, we've heard a lot about discussion about structural racism. So much of the current structure of our laws and our society descends from provisions that had racist motivation.
wow. That's a profound insight, and all the more reason to spur advocacy in this. It just seems very odd that there are there's really two tiers in the labor standards without specific justification. I mean, I know farm workers work hard, but there's, people who work in nursing homes work really hard, and they have a 40-hour work week. And I don't know. I know a few ministers who, work hard and they have a 40-hour work week. So,
Right.
okay.
Yeah, and I think that suggests another answer to Margaret's question. So the farmers say this is going to be an impossible burden on them. Well, every other industry to which the 40-hour week has applied found a way to adapt. And I think we can expect that the farmers are not going to be an exception.
So if I could just add a little bit more into this. Some other wage categories other than farm workers, we need to be concerned about are people like home care workers who right now are getting paid less than minimum wage And so there's a fair wage campaign to bring their wages up to 150% of, it's a substantial increase per hour. And then in matching that is also a bill, which is a 24-hour campaign to say that nobody should have to work more than 12 hours. And because right now what happens is that home care workers can end up working a 24-hour shift. And the wage law provides that they have 5 hours of uninterrupted rest, plus 4 other hours of downtime, and that they end up, after all is said and done, only getting paid for 13 hours out of the 24, provided that they do get that rest allowance. The reality is that when you're caring for a sick person or disabled person, you don't get that rest, and this amounts to wage theft. So we're trying to sort of really push both of those bills. And then the other has to do with enforcing the wage theft, the wage theft provisions, where you have a lot of hospitality workers, for instance, people that work in restaurants who have their wages stolen, up to $1 billion a year. And so there's a bill called the Sweat Bill, which would allow workers to place a lien on a business if they steal their wages. So that's another a few other things which are in play right now before the legislature, and you can see those in our legislative ask on our website.
Well, we're coming up on the end of our time together, but we always like to end with some very specific action steps. And so let me just begin with the 40-hour overtime issue, because that one seems to me to be a little different rather than pending legislation. This is a regulatory issue, right? The advocacy would be with the labor board.
With the labor commissioner, actually.
With the labor commissioner. Can you tell us a little bit about that? How does one write to the labor commissioner? I mean, what does that look like?
I would Google New York State Department of Labor and look for contact information and make sure that you're addressing the Commissioner of Labor, Patricia Reardon, and urge that she accept the recommendation, because the board has already made the recommendation for the 40-hour overtime threshold, and she simply needs to make the determination to accept that recommendation.
Yeah.
Okay, but one writes to the Commissioner of Labor just as one would write to one's legislator and whatever.
Yeah, basically. Yeah, and I think, to ensure that the governor's proposal around the corresponding tax credit also, goes through, that would be also very helpful. So that would be one action. I mean, I think the other is to really lean on your legislators to pass the healthcare package, which Terry laid out there. And also, in addition to that, to press for the Excluded Workers Fund. And all of those things would be very helpful for people to pay attention to. Have your legislators on speed dial. They should be hearing from you often.
Right. There is going to be a coverage for all lobby day, rally day in Albany on March the 3rd, I believe it is. No, sorry, March the 2nd. Mobilization for coverage for all in Albany. So people can look out for that. Again, I don't know if you can share the PDF that I put in the chat as part of this presentation, but that has a set of dates and links in it that might be useful to people.
Yeah, and I'll send that out when we'll put it up when we put up the recording. And I can also send it out to those who participated today. That's really helpful that you put all of that together. I just want to note that that lobby day is linked in Terry's document, so we will all have access to that.
And you can always go to New York State Council of Churches events page, and we post stuff like this up there. And it's, on all kinds of justice issues, and I'll make sure that these links are all posted on our events page as well.
This is extremely timely for us and for our country as a whole. It's funny that this, healthcare coverage is one of these issues that feels like it's just comes up again and again. Such a huge issue in the last presidential campaign, at least in the Democratic primary, and yet it still is unresolved. There's, remains this just, even after 2 years of a pandemic, there's yet to be this sort of real reckoning of what it would mean to ensure that everybody in this country has access to basic health care. And among the many mind-blowing things about this, coming out of this pandemic is the idea that there hasn't been just sufficient public will to address healthcare access, knowing what we know at this point. Thank you so much, Terry, for amplifying that sense of urgency.
Thank you for the invitation.
And
forward together.
Yeah, forward together. And I think next month we will be convening as well. And Fred Bohr had a suggestion for us that we look at a food justice issue next month. And so we shall explore that, and details will be forthcoming. Thank you all very much for your participation. And the struggle continues. Good afternoon, everyone.
Bye.
Thanks, everyone. Thanks,
Thank you.
Terry.